Jim Joyce. And on top of that, wow, man. Wow. I thought I dressed up. I had to look on my, on our YouTube channel what I wore last week.
This is when you're meeting the bankers.
I hear you.
It's a bit old school, but take the t-shirt away, when you see the money men. But you don't. That's your brand, man. You never leave the t-shirt, right?
I mean, I love my t-shirt. I'm trying to remember for my first outing with Fireside Chat with Glen. I actually think I wore a button down, if I'm not mistaken. Maybe no, I don't know. But I do cover. Right. I do the jacket thing. Just no need for it here, sitting on Zoom. Anywho, I don't even know. Like I think my brother-in-law asked, like, "Oh, have you heard about this news?" I don't even know what happened in the last 48 hours. It's just been just nonstop. So I do look forward to this every Wednesday.
The Jewish holiday. What's going on?
Yeah, that was New Year's. I am horrible at this, so I actually had to be reminded that it is. Well, not really, but so it was the new holiday, new year. Don't ask me which year. It's 5,000 something.
Horrible. I was seeing something on that. I was like 5,061, or I don't know what I'm getting wrong.
Yes, 5,400, and maybe you're right. But anyway, yeah, and then I've been kind of following along more. Thank you. Been following more along on Twitter. The what's next healthcare. I think it's the conference that Matthew Holt and DaMassa are running now. Lots of exciting 20 panels. Yours truly was moderating one of them.
Okay.
Enjoyed it, virtual? But I haven't had a chance. Of course, yes, it's virtual. Yes, it's all virtual.
But they want to do something in person eventually. Is that the goal? Or?
Yeah. I think so. I don't know. Well, I haven't actually chatted with them, but we'll find out from them.
Have you booked your tickets for JP Morgan?
No, not yet. I barely even booked my tickets for the HealthXL DTX and HLTH that's coming up in a month-ish. So book your tickets, people. We've had this wonderful human being waiting already in the lobby, so I'm going to move us forward.
Absolutely.
And as I'm going to start letting her in, I remember I reached out to a number of folks saying, "Hey, who are like the top minds in behavioral health?" Right? And I think it was Lisa Suennen that said, "Hey, you need to reach out to. Come on, you can do it." Have you heard me? Have you heard us already talking?
Just briefly.
Just briefly. We were just kind of shooting the proverbial shh. And I was saying that when I first reached out, I'm trying to remember when you and I connected, but this was a few months earlier. I said, "Hey, who are like the key people in like behavioral health?" And I think it was Lisa Suennen was the first, and then your name came up like bang bang right after another, right? So first of all, for our viewers and listeners, neither Jim or I want to really butcher your name.
Solome Tibebu.
That's what he said. He said that.
Yes.
He said that. Yeah.
Yes. I was a little afraid to butcher it. And I know we kind of connected and said, "Hey," but
and it's a beautiful name. It's a beautiful name.
Soul.
Thank you.
It's very soulful.
Yes.
Yes.
And where are you calling in from?
Oakland, California. Not at the moment, cool. But typically.
Oh, typically. Okay. Very good. Well, nice to meet you. I'm Jim.
So nice to meet you.
So are you ready for this craziness? The next, 40 minutes. So we'll take you maybe all the way back. What actually triggered you coming into behavioral health as a field? And then again, like my comment, I'm sure you were doing this before, and maybe just my own sort of dig in and interest in the space was like, all of a sudden, here's Solome. And you're amazingly doing all these things, which we'll get to, but tell us a little background on what triggered you.
Mm-hmm. Totally. Thanks so much. And I'm really excited to be here as well. So, it all began with a lot of anxiety and obsessive compulsive disorder symptoms as a preteen and teenager. It was really challenging. My parents had no idea what was going on with me. I had no idea. Panic attacks, intrusive thoughts, missing school, and there just wasn't really anything online to help me cope or connect with other teens, to know that I wasn't alone. And so in addition to actually seeking out professional help, I was missing that aspect. So when I was 16 in 2006, I started a blog called anxietyinteens.com for 14 by teen online resource. And I continued that nonprofit for 10 years. And then we did virtual peer support events. And that's really what got me interested in mental health, entrepreneurship, the internet. And that was kind of the beginning.
Amazing. And I actually just remember the second name that brought was Dale, brought up your name as well. I think he was a guest on last week, I think. All these weeks are coming together. But going through this as a 16-year-old and actually taking, I'll say, the positive approach of helping others and creating what you created, that's, first of all, just kudos, right? Because there are, I don't know the percentage, you probably know, but I think many kind of crawl back in and don't do anything about it at a personal level, unfortunately, but also at a grand scheme of helping others. So just, again, kudos.
Thanks so much. Yeah, I don't know if I can take that much credit. Part of it was just starting it as a resource for myself. And the other thing is, not only with that, but kind of with any new endeavor that I start, I don't really know what I'm getting into. So maybe that's half of why I even bother starting.
Hey, you're with two entrepreneurs here, so I
gotta figure it
out. We just figure it out, right?
Right.
So you kind of recognized this in yourself. You started a blog, and then you started running events. Is that what you said? You started running events, and then where'd you go from there? What's happened since then?
Yeah. So 5K races, that kind of stuff. So I knew I was interested in mental health and technology, and I decided to be an entrepreneurship major in college, to which my parents said, "Excuse me, a what?" But I knew I was really excited about startups already at that time. And it was junior year of college where I started a mental health tech startup that was essentially online CBT in an app, different exercises, again, out of a personal experience. At this point, I saw several different therapists for my anxiety and OCD. And for anyone who's listening, who might be experiencing some of these things, just as an aside, it really took until the fourth therapist and fourth medication, for that matter, to find the combination that really worked for me. And I really would love people to know that, if I stopped at 1, 2, or 3, thinking that's as good as it gets, I mean, it's been a totally different outcome. So it takes some time, but these conditions definitely are manageable. So I just want to get that out there.
Yeah, sure.
But I saw different therapists. They gave me my mental health homework for the week on a little Post-it note. I said, "Oh, this should be an app." So in college, I started this startup and partnered with some local clinics to pilot it, like built the technology and everything. But long story short, 20-year-old me really underestimated launching an enterprise healthcare startup. So it didn't pan out. Moved on from that.
What was the name?
Cognific, in fact.
Ooh, love it. And what do you feel like when you built that technology? Like, either what was it going to do in the vision that's not out there today, or do you think all these mental health apps have kind of grabbed a lot of your idea? Had similar ideas.
Well, yeah, 10 years later now, it's a whole world, and
which is a whole other discussion that I want to bring up on the kind of the supply side, but let's park that.
Right. I mean, it was basically, I thought, oh, wouldn't it be great if there was video games for mental health? But as I was developing a product for the first time, I was learning quickly that you tell teenagers mental health video games, they were expecting World of Warcraft, and mine was barely looking like Minesweeper. So it wasn't going to work.
Hey, Minesweeper, popular game. So just sometimes it's also timing, right?
But did you the guts of, I didn't have near your courage, at age 20, that's a young time. Like, people ask me, I didn't become an entrepreneur until I was 36. And and people ask me, oh, did you think you waited too long? I'm like, I maybe went out a little too early. I needed to grow a bit.
I definitely did. But
That's
I mean,
So
yeah.
sorry, go ahead. I was going to make a joke.
I was going to say, who would have thought that early experience, whether it panned out or not, would have led to, a whole career in it. So,
yeah. Okay. So you had the startup, and then what happened next?
Yeah, then I moved on and joined the sales team of the largest behavioral health EHR software company, got a real job, and was selling all sorts of ancillary products, RCM consulting to all sorts of behavioral health stakeholders, from IDD to substance use to psychiatric units of hospitals, and learned a ton.
Right.
That was out in the East Coast. Did that for a few years, but I wanted to go back to startup life. So that's when I moved to San Francisco, helped a couple startups and worked for a couple different early stage digital health venture funds. And still at that time, even though I was involved with broadly digital health startups, my passion was specifically behavioral health technology. And that's when I started this little newsletter on the side with Steve Ramsland, and which eventually led to going out on my own.
Okay, fantastic. And because you said we were a little exchanging. I know we call our podcast meticulously unproduced, so no anxiety here, no anxiety here. But what were you saying? You're saying so behavioral health. Give me the definitions that we were tic-tacking with a little bit.
Yeah. Behavioral health, I mean, for me, I describe that as mental health and substance use services under one roof.
Yep. Mm-hmm. Yeah. And then what was the other term that you were using, Eugene? Did I get this right?
Behavioral science, right? And that's, it's but it's interesting. And again, to your point, I don't want to dwell, but I think a lot of people do sort of use it kind of just the word behavioral interchangeably. Thank you. I was blanking out. You got me. We've been doing this for like 75 episodes now or something. But so I think that's the premise of it, right? That people use it interchangeably, and but it's very different things. That's it.
And that's a good segue. But when I think about so I think everyone, in some ways, or lots of people, like you said before, there's a lot of people that suffer from anxiety, and a lot of people suffer from compulsive disorder. So it's a huge, it's and it has to be so undiagnosed. It's almost like the fact that you came into a world where it was diagnosed is kind of even impressive, because it wouldn't have been in my generation. But when you went into the sales field, that seems like that can be quite anxiety inducing, going into a hospital and trying to talk to people. Did you?
And quotas.
Quotas. Did you were just completely coping with it? Did you love that? Did you thrive in that environment? What was your take?
Yeah, another one of those didn't know what I was getting into kind of situation. No, it was hard, especially post meaningful use. It's just a different environment, and no, I had a lot of anxiety, in fact. And one thing that I learned later was, after managing my anxiety as a teenager, and then really getting a grip on it to the extent that I didn't have a lot of symptoms at all later in college. Then I started writing about it, giving a TED talk, and I overcame anxiety and OCD, and then the symptoms came back full force years later as a professional in New York City, and that's when it dawned on me. It's like, oh wow, I didn't conquer this. This is something I'm managing for a long time, and I think I had that was definitely a rude awakening for me. But
so it was this conquer to manage, was this aha moment that it'll be there, but it's okay because you're learning how to manage it.
Well, that's so important too. It's different. I was different. I am different now than I was as a teenager, not having any tools or any skill, and that makes the world of difference, really.
Yeah.
You mentioned writing, and I know on your Rethink is a book that you co-wrote. So maybe talk a little bit of how that was even born. And I'll be frank, I did not get a chance to even look at the content of it. I can assume what it's about, but I would love to hear in your words.
Mhm. Oh, this would be a great opportunity for me to keep running with that and talking about the book, but unfortunately, it's not a book.
Okay.
That's too generous. It's a newsletter.
Okay.
So the Rethink Behavioral Health Innovation newsletter is something that a colleague of mine, Steve Ramsland, who's been in managed care for a long time, we started this monthly newsletter covering all things behavioral health startups, funding, partnerships, and still to this day continue to do so. And it's pretty comprehensive, all the things going on, not super fancy in appearance, but make up for it in content.
The beautiful part about newsletters, you can always turn them back into a book. That was at least the approach that I was trying to take with the hard pill to swallow, which I paused right now. Just it takes too much time.
We were trying to get a book out of Eugene during the pandemic. So like he's at with 2 ideas floating. We got to get it there. Too much.
Yes.
We were also thinking about doing a book for the shot and rewinding the episodes. But again, everything is just, we do this for fun. When this becomes work, then
But it's so fascinating. I was thinking when you were talking about you didn't know what you're getting into and going into a sales role. We had the fellow Beermann on last week, and he was talking about how his co-founder, at first he was talking about how I think he dealt with anxiety or was socially, I'm not sure what the issue was.
He dealt with a number of challenges, which he was very open about.
Yeah, very open about
alcohol.
But then, it was Dale's co-founder who's talking about,
Chris.
Chris had social anxiety issues, and then but then later on in the podcast, he says what he did was he walked into coffee shops to get our first 1,000 customers or something. And I'm going this guy, wait, hang on a second. The guy with social anxiety issues. And he's like, that was his exposure therapy. Would you recommend that?
Yeah, that's pretty bold. I don't know if I don't know if I can comment on, any kind of clinical intervention like that, but I've known Dale for a long time when they were just starting Pacifica, and it's just impressive what that team has done.
Yeah.
No, absolutely. And talk to us a little bit. So is it that the Rethink newsletter then turned into the behavioral health tech? And I think there's everybody, the who is who of all, I think all the logos and the people behind it that were driving these grandiose visions, right? So talk to us a little bit about it. I did try to tune in the last one, but we talked about it. Anyway, separate discussion.
Yes.
How was this born?
Yeah, so no, it's a different thing. So going digital behavioral health tech, that came about at the beginning of the pandemic. I was just on a walk thinking to myself, oh, wow, all of the conferences are getting canceled. And selfishly, I'm losing my opportunity to network with industry folks. And wouldn't it be nice if there was a virtual conference around this topic? Not really sure how I made the leap to I should be the one to organize it, but
that seems to be your story. Continue it.
I've never learned my lesson, apparently. But it is funny because I remember asking a few friends and mentors about, should I try this thing? And some of the questions that I was asking was, are healthcare people ready for a virtual event? Which is so funny now because that's just the world.
That's all we do.
And now already planning the 3rd annual coming up next year. So it's
crazy.
Wow.
Mm-hmm. But so Going Digital is a conference that's bringing together all sorts of stakeholders, payers, employers, consultants, providers, startups, investors, policymakers, to talk about how to advance access to mental health and substance use services through innovation and technology. For me, I'm not a clinician, I'm not a technologist. The technology itself is not what matters to me. It's really, is it expanding access to more care? And so free for anyone to attend, and proceeds go to a charity that we select. So stay tuned for that for the 3rd year coming up.
Excellent. And when you think, like, help us like parse, and I know Eugene, you're familiar with this space as well, but help us parse everything that's going on in mental health right now. Like we have one of our friends, Silver Cloud,
Mhm.
is joining up.
Wow.
I'm well,
Mhm.
Yeah, with
right?
Amwell, and I guess Ginger and Headspace, and it's kind of
Lyra and uh, Calm, I think, right? Partnership, right? So
how do you think about all the technology that's coming out there and all the apps and what's happening, and what's your take on the landscape?
Yeah, I think this is, the Headspace Ginger. I think it's just the beginning of what's going to be a lot more consolidation. It's exciting to see emerging technologies that are focusing on specific conditions that aren't, we're beyond just general online CBT. There's got to be more solutions that are tailored to a broader, more diverse population. So now there are startups just for eating disorders, or just for obsessive compulsive disorder, and
Right.
just cultural sensitive focused mental health startups. But that also means potentially a plethora of point solutions.
yeah,
And I think employers and payers are getting a little overwhelmed. I really think that in terms of what's next in behavioral health is more partnerships, more consolidation to have a more integrated experience for the end patient, member, employee.
Do you think those work? I mean, like Eugene was just at a conference, or was just interviewing Glen Tullman, with the Transcarent interview, and you were talking, and he was very clear that he wanted to own the experience, everything about his Livongo experience, and there, so meaning like partnerships are great, but they also going to be fraught with disjointed experiences. Like, do you think these?
where's the window and where's the front door, right? So
Right.
a lot of this back.
Right. Yeah. Execution is such a huge part of it. Totally. No, I can't disagree with that. But, at the same time, a lot of these specialized things like equip eating disorder, for example, it's not super easy for someone who doesn't have that background or network to just stand up. And candidly, perhaps a partnership makes more sense. Just depends on the situation.
And I think this is the interesting part. I mean, going back in your own history and sort of facing things as a 16-year-old, eating disorders take the same 16-year-old that might be having one, and where do you turn to, right? You're afraid to talk to your parents, you're afraid to. And so I actually think that the fact that Equip is here, well-funded, executing well, and understands that subset of the population, which is huge, this is a great thing for those individuals. But I think the question for me always is, at what point in time some of these integrations and mergers start happening? Because is it enough time to get the right scale, to get the word out, to get the masses even knowledgeable about somebody like Equip before? And again, I'm we're not predicting here, but let's a telemedicine platform buys them anyway to verticalize this, right? And then some of that goes away to a certain extent. To me, is the timing issue and challenge.
Mm-hmm. Yeah, I mean, I could see perhaps more larger players are just looking for their dance partners earlier on, just because it's such a crowded and competitive space.
No.
Or it also takes time to develop outcomes and in our space, if any. So yeah.
Talk to us a little bit about, because I think there's also a spectrum, right? I mean, some people believe, well, technology, and to your point earlier, like CBT will solve it all and self-paced. And I think there's a spectrum of individuals always that are, let's call it, motivated enough intrinsically to do something self-paced and kind of acknowledge certain things, but others need a gentle push and others need some critical interventions, right? And I think there's a spectrum. Can you talk to us a little bit of, like, back to this Headspace and Ginger? Like, to me, the beautiful part is Headspace opened up kind of, I'll call it the masses. Ginger focused on the clinical aspects, and not to say that Megan and team there didn't, but just from a focus perspective. So talk to us about the spectrum and how you see that playing out.
Mm-hmm. Yeah, it's interesting. Well, motivation, I struggle. I don't know if that's, I don't
know if it's the right term.
I don't know if it's the right term. Yeah, exactly. But I understand what you're saying. Yeah, I mean, I'm a bit jaded on just pure tech having a huge impact, especially if you're struggling with something beyond just mild anxiety. I'm an advocate of some kind of human intervention involved with the tech, and I think that's why everyone is coming out with their coaching programs. But having that ability, like even the Headspace example, having that ability to engage people up front with something known and trusted like Headspace is an important step, especially when we're talking about something like mental health, which is still stigmatized. Especially if an employer is offering something, it might be easier if it's something like a Headspace just to get in the door, but as they build relationships and get more comfortable, an opportunity to step up into more significant care seems like it would be easier.
Investments. So I think you also have a part of, talk to us a little bit about the fund that you're doing, because obviously, especially in behavioral health and / mental health, there's been tremendous amount of deals, both early stage, scaling. Where are you with the fund and your focus for the entrepreneurs that are watching?
Yeah, totally. So a fund for the entrepreneurs and a fund for the nonprofits.
Okay.
So for a few years, I've been an advisor of a few funds. The Telecity Fund is a venture fund exclusively dedicated to youth mental health and digital well-being, and as well as an advisor of Hopelab, which also just launched Hopelab Ventures and invested in some of the companies we were just talking about. But I also run the Upswing Fund for Adolescent Mental Health, which is a philanthropic fund, not a venture capital fund, that's focused exclusively on adolescent mental health for LGBTQ teens and adolescents of color. And it really came about through the pandemic. Our inaugural funder is Pivotal Ventures, which is Melinda Frenchgate's personal investment and incubation company. We saw an opportunity. There's just, as if there wasn't enough need for mental health support for this population before the pandemic. You're talking about schools shutting down and providers facing financial strain. That's where it came to be. And we announced our initial portfolio a few months ago.
And who is that portfolio? Do you mind?
Yeah, we funded 88 organizations.
Wow.
So
wow.
Predominantly community-based organizations that have especially cultural sensitivity around serving LGBTQ teens and adolescents of color throughout the country, as well as some larger system enabling nonprofits who are really just transforming the entire adolescent mental health ecosystem through policy or digital technology, access to tech, school-based mental health, that sort of thing.
And when you think about like a lot of the statement, like the first treatments that felt like in my lifetime that came out for attention deficit disorder, we had all the medications, the Ritalins and the serotonin, that whole class of medication. So it was always this concern about overdiagnosis of a condition. That was the kind of the quid. It was like at once people say there's underdiagnosis, and then another group say, are we correctly diagnosing people? And then we think right now, with all the world's, information at our fingertips through Google, where are we at in kind of correct diagnosis and the right diagnosis?
Mm-hmm. I still think totally underdiagnosed, like for all of the barriers for especially adolescents and families getting access to care in the first place. And I'm sure there are a lot, and less so, I think stigma is reducing a bit, more so for just mild anxiety and depression, not so for much else. But even something like stigma alone is prohibiting families from seeking out professional mental health, that they may not even get that diagnosis. So I still think actually it's quite a bit.
And I think that goes back to a little bit of, yes, there's the stigma still exists, especially, kind of within the family and in all the circles. But I also think it's difficult for people to still, with all of those apps and all of those virtual services, it's still difficult to find the right therapist for yourself, right? And sure, there's matchings and this and that, but it's like, to your point earlier, if you didn't persist finding that fourth one that really helped you through this, many people just quit. And I don't know what that answer is going forward.
Right. In addition to just the massive shortage of providers.
Thank you. You bring that up now. I was gonna go next, like on kind of the supply of talented providers, right? That actually can help people through this. I don't understand, with all of the funding rounds and the scaling. This is where I think the technology comes in. But back to your point, and again, whatever the right term to use, but you need a human being to help you through this process, management process. I loved your comment earlier on conquering versus managing.
Yeah, I think, what's the solution to those things? I think some companies are getting more sophisticated around how they're triaging patients or members or employees to ensure at least that the right level of care is being provided to one member versus the other. So the specialists really are just serving the severe folks versus maybe more self-guided for mild. But yeah, I think some more startups are getting creative with where can they use unlicensed folks, coaches, and not where they need to. But yeah, can't make more mental health professionals fast enough.
Exactly.
We could produce them through some kind of augmented reality robots.
That would be, that would be something.
I was just hearing about that, actually, talking about that your therapist, could be a robot, right, in the future.
There's the chatbots, there's the, Wobot raised 90 million. And I think had some study come out about data around actual therapeutic alliance from the interactions. So things are advancing, but
they're definitely advancing. And I'm going to rewind back to when I was addicted to Clubhouse for about a week. And I jumped into some like AI bot room, and I honestly don't remember the startup, but the founder was saying that they're literally that founder, as they changed the persona of the AI chatbot, and it was a female persona, there were just a bunch of angry males that would be attacking the entrepreneur, saying, how could you change that persona? Like, please don't revert about. People got addicted to those discussions and really believe that that's a real person on the other side. It's
fascinating. Like with my wife just got with her Siri, like my son's Siri is an Indian accent, and then my wife got one with an Australian accent, like gives her shit, like kind of makes fun of her, something like that. I did it on the Siri, and and then I was driving in a Tesla, and all the Teslas are personalized to the user. So when you go into the Tesla, it's going to be like, you're calling your Tesla something, a certain name, versus the other person's Tesla, you're talking to it. Like people get very attached to these things.
Yeah, exactly. That level of personalization. And I think that's where, we were talking earlier, right? Like, how do you bring, because every individual's challenge is truly unique at the end of the day. And so how do you are able to personalize the combination of technology and, the human aspect of it? And I think that's for the overall health and care ecosystem to solve this all together. On that note, Oh, go ahead. I mean, I'm not in a rush.
With my device, my company's it tracks people that take injectable medications in the home, but right after they take their medications, we smile at them, so they'll smile. And that was initially the idea of the smile was we couldn't get the tech to work on early prototypes. So we're like, well, what do we do instead of having a YouTube, spiral? I'm like, well, just smile at them. That's what I do in life anyway, and just smile at them. And so anyways, we smiled at them, but then we launched the product, country to country, and the way the different cultures reacted to the smile was fascinating. So like the Irish people that went into it were incredibly, they didn't want to disappoint. They were worried about disappointing the smile. Like they didn't take the medication, and then the Belgians thought it was condescending. They thought it was condescending.
It's interesting, right? Interpretations. Yeah.
Right. Like culturally, just
Cultural.
a smile, nothing else. It's just little eyes and a little smile. And they were all reacting to it and very emotionally, very differently. Yeah.
Huh. Yeah.
Anyway.
No, I mean, it's a good point. Back to this personalization, right? Like the cultural aspects of this are super important, both technologically and at a human level, right? I mean, obviously.
So picture yourself. We go in there.
I was going to say, Jim Joyce, with your final famous question.
So picture yourself, a very talented, bright teenager, or teenager that had learned how to tackle her mental health issues by writing and hosting events, and eventually went on to do a startup, and they want to do a startup in the mental health area, developing a robotic therapist. What advice would you give to that young entrepreneur right now?
Robotic. Yeah, I guess I would say reach out to as many people as possible who in every facet of taking that next step, business, clinical, whatnot, that did end up working pretty well for me. Out of all the things that I didn't get quite right, I do think that early on I got off campus, I talked to business leaders. I think I got a lot of goodwill as a student, and you just never know where things will lead and what you'll learn. And people really do want to help others, especially when it's something as impactful and prevalent as mental health. So that would be my advice ongoing.
Excellent.
Amazing.
Excellent.
Well, listen, thank you for making the time. And I am sure this is not the last time we're speaking here, so we'll be in touch. And for all of those wonderful millions of listeners and viewers that we have, just subscribe, share the message.
Amazing. Thank you both so much.
Thanks. Pleasure to meet you.
Thank you.